Afternoon, everybody. The time is now 3 o'clock on Friday, October 23rd, 2020, and we are gathered in an online platform, Zoom, due to the ongoing public health emergency. I'm David Grosso, chairperson of the Committee on Education, and I'm calling to order this joint roundtable of the Committee on Education and the Committee of the Whole. DCPS is in the process of readying for limited in-person instruction. Just yesterday, the Chancellor gave a detailed briefing on the DCPS plan to the public. This roundtable is designed for council members to ask follow-up questions to our regular weekly meetings. Our offices have heard a lot from the public on this topic via phone calls, meetings, emails, tweets, and every other form you can imagine. So this is a time we're making available for public conversation for council members to speak directly to DCPS about their concerns. Given the nature of our hearings during the pandemic and to maximize time for council members to ask questions, there will be no opening statements. Each member will be given a 10-minute round. And then depending on the time we have left, we'll get a second round of questions. I'm going to go ahead and proceed until the chairman gets here by letting the Chancellor make any comments that he would like to make in the opening of this hearing. Chancellor Farabee, thank you. Oh, hold on one second. Chairman Mendelson, as soon as you get logged in there, I'll turn to you if you have any opening that you'd like to make.
I'm sorry, were you just talking to me, Mr.?
Yeah, do you have an opening statement? I've already gavelled in and I was going to move to the Chancellor, but I was going to check with you to see if you have something to say.
I think I'll pass on an opening statement for the moment.
Great, then I think we'll move right into Chancellor Farabee. Chancellor Farabee, thank you for being here. And if you have any opening that you'd like to present, now would be the time.
Thank you, Chairman Mendelson, Chairman Grosso, members of the committee and staff. I am Dr. Louis D. Farabee, Chancellor of the District of Columbia Public Schools. Thank you for the opportunity to share DCPS plan for term 2. I look forward to continuing our conversation, and we use this time today to provide an overview and highlight the steps we're taking to prioritize student and staff safety. As a core part of this work, we are committed to clear lines of communication and authentic engagement with both our families and DCPS staff. I encourage the community to visit our website, dcpsreopenstrong.com, for more information on our reopening plans, from learning models and student selection to health and safety preparations. Since our term 2 announcement, we have hosted 3 public forums which have been viewed by over 10,000 community members. Since the onset of this pandemic that has affected too many families in our community, DCPS has remained grounded in the firm belief that to best serve our students furthest from opportunity, such as students experiencing homelessness, those students from families that are identified as at risk, learning should take place in the classroom with clear safety precautions. This responsibility has been at the center of many of our discussions with parents, staff, and students around safely reopening our schools. We will continue to act in good faith with everyone, including the WTU, to ensure families are able to access high quality instruction and the resources they need and deserve. Across the district, students, families, and educators have adapted and enhanced new routines while adjusting to learning at home. At the same time, we know learning at home is not working for every student and family. The decision to take this significant step was made with safety and equitable access top of mind. Beginning in term 2, DCPS will reopen school buildings with 2 different learning models for students in grades pre-K through 5. For both at-school options, we will prioritize classroom seats for our elementary students with the highest need based on current enrollment information and through a randomized selection process. First, with our in-person learning classrooms, students will learn in small cohorts that are school-based with live instruction in person. The daily schedule will be similar to that of a typical school day. With our Canvas academic and real engagement or care classroom, students will have supervised care for the school day from a trained adult who is not their teacher. Students will have the benefit of being with their peers at school, but will also participate in lessons virtually on a computer. This program will begin in mid-November and will add additional classrooms over several weeks. A full learning opportunity at home will continue for students and all families in grades pre-K through 12, for those families that prefer this method of instruction. For our middle and high school learners, to ensure continuity with semester schedules and grading practices for all 6th through 12th grade students, we will continue with learning at home for those students for term 2, with a planned transition to in-person learning at the start of term 3. Additionally, select middle and high schools will continue to offer student support centers and career and technical education programming in person. It is our hope to allow students, especially those furthest from opportunity, to return to schools and receive the critical supports that prepare them for success in life. We plan to provide a safe and supportive learning space for our youngest learners. We also see more challenges with virtual learning and other in-person instruction for students facing opportunity gaps, with the goal of mitigating learning loss. Our commitment to prioritizing safety, maximizing learning, and equity guides our planning as we prepare to enter into school buildings and facilities. Through Mayor Bowser's leadership, DC has invested over $31 million in safety measures for schools, including $3.6 million for additional PPE, $4.5 million for building readiness initiative, and $24 million to enhance HVAC systems. We have created operational guidance that meets the health and safety protocols, planned professional development that ensures workforce readiness, and create multiple ways for our school community to build an understanding of and monitor compliance, which is critical to our new operational routines. We are utilizing a set of building readiness standards to ensure every facility is ready to welcome students back into a safe learning environment. These standards align with public health guidance issued by DC Health, OSCE, and the CDC to mitigate the spread of COVID-19 when schools may reopen. Schools have received detailed guidance to develop individualized operational plans prior to reopening. After these are implemented, school leadership, operational staff, and relevant central office team will conduct building walkthroughs alongside parent and community leaders to determine schools can safely reopen. Additionally, the monitoring of new routines and safety protocols will take place on a regular basis after students and staff return to in-person learning. Regarding health screenings, DCPS is committed to putting in place robust health protocols for staff and students. All DCPS schools will have COVID-19 symptom screening procedures in place for staff and students. We ask that parents and guardians proactively identify when a student exhibits COVID-19 symptoms or have been exposed by using Ask, Look protocol prior to arriving each day. In addition to our screening process, we are providing schools with rapid COVID-19 tests in the event that there's an individual that presents symptoms during the course of a school day. DCPS staff is working in person will also be prioritized at all DC Health public testing sites. If a student, staff member, or community member who was in a building tests positive for COVID-19, schools will follow the health and safety guidance released by DC Health and OSCE. Through the DCPS COVID-19 response protocol, every staff member will be trained to confidentially report potential exposure in a building. The positive individual will immediately begin working or learning from home and consult with a healthcare provider. We will provide self-quarantine instructions to close contacts, notify students and staff in the building about the positive case, and follow all steps outlined by DC Health for cleaning, disinfecting, and sanitizing the school building. I appreciate the DC Council's commitment to health and safety and the well-being of our staff, students, and families. I also want to recognize our shared understandings of the belief that in-person learning, and we hope to continue to provide in partnership a strong reopening. Thank you for the opportunity to provide more information about our reopening. I look forward to answering your questions at this time.
Thank you very much, Chancellor Farabee. And now we'll proceed for 10-minute rounds. And there seems to be some confusion as to why we're only doing a 2-hour hearing. This is the time slot that we could get that was available. And the Chancellor has a complete hard stop at 5 o'clock today. And that is part of the reason why. So if there are follow-up questions, I anticipate there will be. We can send them in writing. We can do it as a joint committee and committee of the whole letter with everybody, or people can send their own letters, whichever they prefer. But that is the reason why we're proceeding the way we are. I'll start with 10 minutes and make sure we start the clock, please. Chancellor, DCPS uses reading inventory as a reading assessment for grades 2 through 5. So where are our students when it comes to this assessment? So there's been some theories bantered around on the internet that these numbers are false, questioning of the testing protocols, the motives that you have, and even if those are real data points. Can you quickly walk through the testing protocol for DIBELS, TRC, and the reading inventory, please?
Yeah, thank you. DCPS remains committed to ensuring that we have a clear understanding where our students are academically, especially with early literacy skills, and that data is used to inform instruction. In the virtual posture that we are in currently, we reduced the number of mandatory assessments for this year. As a result, we are fully completing required assessments for early literacy, which includes DIBELS, which is our early literacy skills assessment for students in kindergarten through 2nd grade, and TRC, which is text reading comprehension, and reading inventory for those students that need additional assessment and reading comprehension to be used for K1, and the reading inventory is for 2nd grade. We prioritize these assessments because we know it's critical to, again, to understand where our students are as it relates to their literacy skills in K through 2. And the data that we've reported reflects our TRC results, which show a decline in the readiness for reading and early literacy skills. And it's also important to note that we are also beginning to implement our reading inventory assessment. For those students that are in grade 3 and higher, we are administering our ANET assessment. Those windows will be opening up and we'll be able to provide information to teachers on performance as relates to those ANET assessments.
So what are the risks if these types of numbers that you're reporting are not addressed? I mean, what are we looking at for kindergartners, for example, who start off, as you've noted, 22% points behind? I mean, it doesn't make, it doesn't make for a good future for these kids, and I worry about them being able to make up these grades. So tell me the risks.
Well, the risk is that we know that the younger the learner, the more challenged the results are as it relates to learning at home. And so we believe that this is a confirmation that we need to prioritize our youngest learners, particularly for the data that we're seeing in kindergarten and 1st grade. If we could do a comparison of where students are beginning of year in previous years and where they are now beginning of year currently, we have seen a sharp decline. And that decline is more pronounced for some of the most vulnerable groups that we have prioritized for in-person learning experiences.
Thank you. So New York City has returned to in-person classes. They have, I think, nearly 500,000 students return to the classroom there. And my understanding is those schools are receiving a deep cleaning nightly. All the HVAC systems have been upgraded. Random temperature checks are done, and school staff are asked to test 7 days before coming to the building and then monthly thereafter. I believe they've even done some randomized testing of teachers and students who have signed a permission slip to do so. If New York City can get this done for 500,000 students, my question is, why can't we do this for 20,000 students? And I'm wondering, how does your plan here in the District of Columbia compare to New York City's plan, or does it differ? And that's why people are worried.
Yes, so there are many similarities to our plans. They also prioritize their youngest learners, and many similarities as relates to health and safety protocols, such as social distancing, cohorting students, ensuring that there's screening, temperature checks, and enhanced cleaning. I think the differences around testing are DCPS is not at this time considering randomized testing. We believe that there's no evidence at this point that that strategy is superior to our other mitigating strategies for COVID spread. And so as a result, we will rely heavily on our other mitigating strategies. We have taken a more advanced approach to the HVAC systems. We have had the fortune of having a professional engineer that is a part of a national network that is supporting schools with their filterization and ventilation, who has designed a specific plan for each of our schools to be executed by contractors, and will also include a review of all of the enhancements that are complete. And we're fortunate to have Mr. Setti, who is that engineer, be a part of the discussion today. And that association that he represents is the American Society of Heating and Air Conditioning Engineers, who are the top experts in this area. And he is a member of the Epidemic Task Force school team.
Great, thank you. I'm sure there'll be questions where he'll be useful for answers. It sounds like to me though that randomized testing would ease some people's minds in this scenario. And I've heard from principals and teachers alike on this issue. So why are you not considering this as an option? I mean, I know you have other mitigating factors, but why not just do it to give people some peace of mind?
Yeah, so we believe that our testing capacity will allow for anyone who would like to be tested regularly to do so. And so my understanding, the model in New York, that is also a voluntary model. And so as a result, we have prioritized times in which individuals on the DCPS staff or working in person can receive a test as much as they would like and can do so on a weekly basis. However, the CDC has raised significant concern and believe that there are significant equity issues with required testing of students. And I believe in the New York model that is also optional. And so we don't believe it's DCPS best interest at this point to require families to administer testing. However, if a family believe that that is the best option for them and their child, again, they have the ability to do so. Okay. And we are also providing testing for any symptomatic student or staff member in the building. We have the ability to provide a rapid test on spot in the school, should again anybody be symptomatic. And so I think the difference is the surveillance style testing that they're utilizing on a randomized basis.
Thank you. So recently there were reports of secondary school staff being asked to come in for your CARES classes, which is the alternative type teaching where students come in on virtual. I'm wondering what the value of these CARES classrooms are. Is it simply because you don't have enough teachers that are willing to come and do it in person, or is there some alternative value to it that I'm not aware of that means that some students would come into the building but not actually be in-person learning but still be virtual learning with a trained adult there? What's the value there?
Yeah, so we have looked across the entire DC staffing model, DCPS staffing models to identify where we could redirect staff and detail staff into our student care classroom. That includes central services, that include our elementary and secondary schools. And we look specifically for individuals where we anticipate that there would be minimal disruption to a school's ability to continue to.
Chancellor, I'm sorry to interrupt you. I don't have a little bit of time here, and I'm curious, why are you doing these CARES classrooms? I understand it. We're getting gripes from people about it, but I want to know what the point is. Why can't they just do virtual learning where they were at home? Why do they have to come into the building to do virtual learning?
Yeah, so as I mentioned earlier, we know learning at home is not working for every family. And there are significant challenges for families as relates to supervision and engagement with learning at home. Some families have the network and capacity to be engaged with the student when they're learning at home, but not all of our families have that capability. And we are seeing a spike in our CFSA referrals for those students that are young children at home, not being supervised properly by an adult. And some of that is due to family obligations, responsibility, and the need for families to work. And so we know that that concern exists, and we're starting to see evidence of that. And we believe that, again, students learn best in school. And then beyond that, we also know that there are social and emotional benefits for students being in school and interacting in person with their peers. And that has been noted by pediatrics across the nation. And we believe that's important, especially for—
So Chancellor, then why not just put them in in the in-person classroom. That's the point I don't understand. I get all the points why you want to bring folks in. Do you not have enough teachers to do the in-person classrooms? Is that what's going on?
Yeah, so we established a protocol of having one in-person learning classroom per grade level at every elementary school. We believe that this is the least disruptive way to provide in-person learning classroom. Providing more in-person learning classrooms or detailing more elementary teachers to our care classroom would provide more disruption to our ability to have successful virtual learning for our students, which is why we look to other staff members to assist us in providing supervision for the student care classrooms.
Great, thank you for that. And my round is up. I'm gonna go pretty much as I saw people join the hearing today, but start with Chairman Mendelson, who's the co-chairing this hearing with me. Chairman Mendelson, 10-minute round.
Thank you, Chairman Grasso, and thank you, Chancellor Farabee. I'm going to start with questions about the teachers and staff in the schools. When a teacher tests positive, will the teacher be forced to take their own leave, or will additional leave be provided?
So if a teacher tests positive, that teacher will be required to work virtually, and there's no need to have a teacher take leave if they're working virtually. However, if a teacher has an illness or a sickness that prevents them from providing virtual instruction, then leave will be provided in accordance with our local and federal guidelines.
I'm not quite sure what that means, local or federal guidelines, because I'm going to ask the same question regarding quarantine. So if a teacher doesn't test anything, but because of contact has to quarantine, are they going to have to take their own leave?
A teacher would not have to take leave their own quarantine because they would complete their work virtually.
What if they're supposed to be doing the classroom the in-classroom teaching? They're going to be switched to then distance teaching?
Correct. They would support students virtually.
Okay, so let's go back to the teacher who can't, because they contracted COVID-19, and they can't conduct the virtual teaching because they're too sick.
Yeah, if an individual again is ill and they're not able to provide virtual instruction, they do have access to leave in accordance with federal and local guidelines. So for example, there are very generous COVID-related leave that will be provided to any individual that can't work as a result.
So that's supplemental to their own leave that they may otherwise have.
That is correct.
There's a question that we've gotten about hazard pay for teachers who teach in person. Hazard pay?
DCPS is currently not providing hazard pay to any employees for working in person.
Will DCPS guarantee that no teacher or staff member be forced to take unpaid leave or lose their job because they cannot teach in person? Or because they may have a family member who may have an underlying condition?
Could you repeat that question?
Will DCPS guarantee that no teacher or staff member be forced to take unpaid leave or lose their job because they cannot teach in person, or because a family member may have an underlying condition?
Yeah, so DCPS has provided to teachers and employees guidelines for COVID-related leave, which includes caring for someone in a home, or there are any health conditions that may exist with that individuals or individuals within their household. They have to provide documentation of that, and they are provided then with the COVID-related leave that's associated with their circumstance.
Now, DCPS was proceeding with its plans for reopening, and then PERB the other day said that you have to bargain. So what's the status of that?
PS has been and will continue to bargain with the WTU in good faith. We are in a bargaining session today. We've been bargaining session every day of this week, and we are aware of the preliminary PERB hearing, and DCPS will comply within the time period as required, which I believe is on Tuesday. But our expectation is that we reach an agreement with the Washington Teacher Union, and hopefully we'll be able to do that today.
I was going to say, how would you characterize the negotiations?
The negotiations have moved fairly quickly most recently, and there's been a will to create as much time as possible for those discussions. And so I'm grateful to the Washington Teacher Union bargaining team and also our team for making the time to negotiate. And there are only 2 remaining issues, in my understanding, that need to be resolved based on our current conversations of today.
Now, DCPS is going to provide rapid tests to symptomatic students.
That is correct.
What about asymptomatic students?
DCPS is not providing any testing to asymptomatic students that is required. Families can choose to use any of our public sites for testing if they prefer to do so.
What about temperature checks in the morning? Will it be doing those?
Yes, we will be providing temperature checks in the morning every day as a part of our screening process.
So a student shows up, student seems perfectly normal and happy, no test. There will be a temperature check. Turns out that the student has a fever. Then will you test that student?
Yeah, if a student exhibits symptoms of COVID-19, we will test the student via our rapid test, and the student or staff member that exhibits any COVID-19 symptoms will be in an isolated space with a medical health professional.
So a fever would be a symptom?
A fever would be a symptom.
Now, I want to ask which rapid test will you be using, but if you gave me a name, I wouldn't mean anything. Some tests are more reliable than others. Are you looking for the most reliable rapid test that there is?
Yes, we believe that we have the best in class rapid testing capability, which has been provided to us and vetted by DC Health.
By DC Health, you said?
Yes, by DC Health, that is correct.
What are the criteria for closing a school if there is sufficient COVID-19 exposure? And actually, I don't like the way I asked that. At what point do you close a school because of a COVID outbreak?
That would be reviewed on a case-by-case basis. The scope in which individuals test positive, the number of close contacts will also be considered, and then the impact on operations will also be considered. We, however, as a part of our transparency efforts, will provide reporting to the entire school community on any positive case, whether it be staff or students, and we will follow DC Health and OSCE protocols as relates to quarantine and informing close contacts.
So hypothetically, my kid goes to the school down the street and somebody tested positive in that school, you will be reporting to all parents. Repeat that question. You said if my kid is going to the school down the street, somebody tested positive in that school, DCPS will be reporting that to all of the parents?
Correct. Any positive case within a school will be reported to the school community.
But now I asked about the criteria for closing a school. Do you have that written, or will you have that written, or is that somehow case by case?
It is a case by case. It's important to know, however, DCPS is following very rigid cohorting models to ensure that there are places in which we are minimizing the spread or transmission of COVID-19. And also we have our mobile HVAC units in each classroom that provides enhanced filterization, including ultraviolet light. And so if there is a particular positive case within a classroom, only those individuals in that particular classroom would be close contacts, and we would communicate the procedures for responding accordingly with those students or staff members.
Let me just venture that I'm a little, I'm not sure I'm comfortable with your answer to this question about criteria for closing a school. I'm struck by the fact that the Department of Health has developed different metrics for measuring. They've been using those mostly for whether we go from phase 2 to phase 3 or phase 1 to phase 2. And it's a variety of metrics, and with a green light, a yellow light, a red light. And I'm just not hearing that with regard to the criteria for closing a school. And I would think that there need to be some metrics around that so that you have something more than just case by case.
Yeah, so for individual schools, if there's a positive case or a cluster of positive cases, we would consider the number of cases, the number of close contacts, and then also the impact on operation. Ideally, we would only self-quarantine or quarantine close contacts or cohorts that have been impacted. Obviously, if more impacted classrooms are concerned, then that would be a consideration for closing operation for that particular school. As relates to all school operations, the city and DC Health will guide DCPS in those operations, and the same indicators that are used for the city monitoring process will be used for schools, which includes the transmission rate, positive cases, and the city's ability to respond to elevated transmission of COVID-19.
Thank you, Mr. Chairman.
Mr. Grasso, thank you.
Thank you, Mr. Chairman. I'm going to turn now to Councilmember Gray, and then after that, it'll be Councilman Nadeau, and then Councilmember Allen. Councilmember Gray?
I think I'm unmuted. Can you hear me, Mr. Chairman?
Yes, we can hear you. Go for it. Start.
Okay, great. How about now? Can you hear me?
Yep, we can hear you.
Okay, great. Thank you very much. I'm going to truncate, in the interest of time today, since we have such limited time. I'm going to truncate my questions a bit today, since the Chancellor is going to be at our Leadership Council meeting in Ward 7 tomorrow, and I know that there will be issues, similar issues that will be raised there. So I will conserve my time a bit today in deference to tomorrow. Chancellor Farabee, can you talk about how the effectiveness is being measured of learning at home for our students at this stage? I mean, we've had a number of issues that have been raised about the efforts that have been made around children learning at home, but I don't understand at this stage how effectiveness is being measured at this point, and in what ways are they being measured? So can you speak to that if you don't mind, sir?
Yeah, so DCPS continues to ensure the highest quality education possible for our students who are learning at home. Foundationally, we want to ensure that every student has connectivity and a device for learning at home. Yeah. DCPS has distributed over 30,000 devices. We've also distributed devices to our pre-K3 and pre-K4 students, which is the iPad, which is the developmentally appropriate device for them. DCPS also regularly monitors engagement through attendance. It's important that we have a 92% attendance rate, which means that 92% of our students enrolled are logging in on a regular basis and actively engaging with their teachers and staff. And then we are now starting to collect assessment data on academic performance and understanding where students are in mastering.
And how are those, what instruments are you using, Chancellor, for the measurement, for that assessment, those assessment efforts? And who's administering those testing instruments at this point?
So our teachers are administering those assessments with students directly. We have ensured that as many of our assessments we can has transitioned to a format that they can be administered in a remote fashion. As a result, we have started our early literacy assessment, which includes DIBELS, which is assessment of early literacy skills, ERC, which is assessment for reading comprehension. And then schools may also use our reading inventory tool. And then for our students in grades 3 and up, we utilize our ANET assessment. And then we also are collecting data of ANET for English language arts and math. And we will collect that data in 3 windows throughout the school year to better understand student performance there. And that data will be used to inform any interventions at the school level. Additionally, required assessments in early literacy and ANET. We have our curriculum-based assessments that are provided to every grade level that represents the grade level standards. And these curricular tasks are another way that all of our schools can better understand student mastery. And the curricular tasks are new tasks that we created this year.
Okay, the next question I'm going to ask is one I've asked. We've had these calls, as you know, weekly on Wednesday to ask about, what we're doing to address these issues across the city and especially in our schools. I have repeatedly asked, and I really haven't gotten an answer yet that is satisfactory to me, and that is parents who want to actually go visit the schools where their children are attending. I really don't understand how that's to work. I don't know how we can say to parents that they should send their children back to school and they themselves don't have, some level of comfort as a parent that their child is going back to a school where there has been adequate surveillance, adequate monitoring, and the parents themselves haven't had a chance to be able to do this. So can you address, as succinctly as you can, address exactly how a parent is supposed to be able to, let's use Ward 7, for example. Tell me how parents in Ward 7, let's say they go to Beers or Randall Highlands or, one of the other many schools, DCPS schools we have in Ward 7. How are they supposed to reach a comfort level that the schools are really ready for their children to be adequately served when they go back to those schools?
Yeah, DCPS is committed to ensure that there's great transparency around our building readiness.
But how is that transparency working? Explain that to me. That's what I want to understand. I don't know how the transparency is supposed to occur.
There's a public-facing building readiness checklist document that will be made available for each school, which includes the school's individualized operation plan. There'll also be a walkthrough team that will have the facility open to them to do a walkthrough, and we will have no more than 12 individuals participate in that walkthrough as a health and safety measure. But within that 12-member team, that can include the local school advisory team chair or designee, a teacher or another additional member of the local school advisory team member, and another parent for the local school advisory team member. The building representative from the SCAC, also the custodial or foreman or engineer within the building, and then health professionals assigned to that building. And they will have the ability to do a walkthrough and do a tour of the facility. And then we're also supporting our principals with providing virtual walkthroughs of building as much as possible. However, we are minimizing visitors in the building as a health measure. And so unfortunately, we're not able to have wide scale visitors in the building as this would create a significant health risk for our staff and those families visiting.
And I can understand those concerns, Chancellor, that you might have about the numbers of people and who they are going through the building and whatnot. I just really still don't fully understand how this is supposed to work. Suppose you have councilmen, let's say me in Ward 7. I want to be as sure as I possibly can, as I work with my colleagues on the council, that what's happening in Ward 7 is something that they can feel comfortable with based on my involvement with this, that there's a process in place that will ensure that our kids really are being adequately addressed in terms of the monitoring that needs to go on. I heard Mr. Grasso say earlier, he talked about what they're doing in New York with 500,000 kids enrolled in their public schools. We don't have anywhere near that. But I know from the parents who I've talked to, the parents who inquired, called our office and asked questions, they desperately want to feel like they're sending their children back to something that they can feel that the children are safe in. And I still don't feel that way. I don't see what the process is that is actually going to work on behalf of these children, Chancellor.
Yeah, as council members who represent the constituents that you reference, We invite council members to be a part of that walkthrough process. We invite council members who are interested to have time in which they can do a walkthrough of the building as well and have the ability to review the items on the readiness checklist for schools.
Okay, I'll finish after this, but will our nurses be available? I know we don't have a nurse in every school, and parents have increasingly demanded that we have a nurse in accordance with the legislation that we passed. Will the schools that have nurses now, will those nurses be available to serve these children?
Yes, the expectation is that our school nurses will continue to serve their school. It's important to note that there's a school nurse assigned to every building. And then we, in addition to that, are ensuring that there's—
I mean, is there a nurse available in every building? Because that's not what I understood from the Department of Health, that there was not, that they were using allied health folks to do some of this work.
There is a nurse assigned to every school building. However, in addition to the nursing assignments, there will be a health professional at every school. This additional medical staff at every elementary school will include nursing techs or nurse practitioners that will support school nurses. And these individuals can assist with our isolation rooms, can also assist with screening, and also could potentially assist with administering any rapid testing. But we do have our nurses that are assigned to our health services suites in our buildings.
Okay, well, I'm glad to know. I did not know that we had a nurse now assigned to every school building, and I want to be able to verify that. And as I walk through the schools, I want to be able to verify that myself. Chance, I appreciate that. Last question I'll ask.
Vince, just make it quick because you got 5 seconds.
Clarify,
okay.
Supporting the nurses are nurse technicians, and then we also have other registered nurses as well that are able to serve as well as.
Okay, I appreciate that, and my time is up. But I would appreciate being able to have the information provided to us, provided to the Health Committee, and provided to my colleagues on the council that will verify that we in fact have nurses actually assigned to every school at this point. So my time is up, and I had another question, but I'll wait till tomorrow to follow that up.
Thanks.
Thank you.
Thanks, Councilmember Gray. Appreciate it. Next, we're going to hear from Councilmember Allen. Councilmember Allen.
Thank you very much. Thank you, Councilmember Grasso and Chairman Mendelson for holding this hearing. I'm very glad we're having it. I do feel like I've got to note that I'm disappointed that we don't have public testimony. But I know as a DCPS parent myself, trying to balance work and childcare is tough. It's been stressful, even for a family like mine that's been relatively lucky throughout this pandemic. And I know it'd be wonderful for me and my family if my kids could be back in school, getting instruction and social development they need. But I also don't want my kids or anybody else's kids back in school before it's safe, meaning safe for them, safe for our school staff, and safe for the community at large. They're going to be impacted by our choices. This is something I think families around the district are feeling. And I'll be honest, I'm at a point where I don't have faith in these plans for reopening. Parents and teachers across the district are telling me they don't have faith, and they feel that their needs and concerns have not been taken into account during the planning. I can tell you as a council member, I haven't been asked by DCPS for input on reopening, neither my own nor to share what I've heard from constituents around Ward 6. I think the lack of communication has left principals and school leaders blindsided, teachers anxious and feeling ignored, and parents confused and unsure whether sending their student back to the classroom is safe. I want to emphasize a few issues that I'm most concerned about and what I've been hearing from Ward 6 parents, and then I have a few questions. First, I am glad that DCPS is vulnerable students. In so many ways, this pandemic has disproportionately been impacting Black and brown families, and I have no doubt that widening the achievement gap in school is going to be one of the ways that we're seeing that take place. But I'm concerned that there's a one-size-all approach going, and should that be the right way to go? I'm not sure how it's equitable when every school gets one class per grade of 11 students. So let me just look at Ward 6. That might support all of our at-risk students at some schools like Brent or Maury Elementary, but how about Minor or Payne or Amadon Bowen or Walker Jones? It doesn't even begin to cover the number of kids that can benefit from and need this small in-person learning. The plans as outlined now also are very disruptive. In particular, teachers in all grades are being reassigned, non-teaching staff in middle and high schools with little or no elementary specific expertise now being placed into elementary school classrooms. That leads to the second concern, which is putting those non-teachers into classrooms during such a disruptive time. If you ask anybody who's been a first-year teacher in the best of times, the idea that somebody who's not trained can walk into a classroom with no problem and just create a safe, nurturing environment, I think it's a bit insulting to our teachers. I'd like to know more about how the staffing decisions are going to be made, what the preparation for our non-teaching staff are going to be, in particular in the care classrooms. To what degree are teachers and principals going to be in control of the staffing plans within their schools? What happens for the unfilled positions at middle or high schools if they're being taken? Third, I hear from parents and teachers. They want to know more about how our school buildings are going to be prepared. We assume DCPS is modeling its plans on best practices elsewhere, but we've also seen in most districts that have reopened spikes in cases and a return to virtual learning. So it's got to go beyond just some HVAC upgrades and cleaning procedures. Fourth, parents are telling me they want to know how is out of school time programs? How are those programs going to, that rely on community partnerships, how are they going to be impacted? Our children are missing out on a normal school experience. We know that, and it's difficult, and there's a lot of hard work taking place right now. They're missing out on the social and emotional development that begin by being with their peers. They're missing out on substantive instruction, and we're going to have a lot of work to do to address the disparate impact all of this is having on our students, but especially those most in need of specialized instruction. I am glad that DCPS is looking for ways to begin addressing those needs now, but I hope that we're taking advantage of the expertise all around the district by being collaborative and communicating better. I'm going to move to a couple of quick questions, recognizing that we only have 10 minutes. Chancellor, I'm going to follow up with specific questions. I also have a lot of parents that have sent me questions that I'm going to compile into a letter for you as well. But one question I've got is I guess really just yes or no. If we're taking this approach where one school, one class, 11 students, is that equitable?
It is equitable. It is the least disruptive model for our schools. Now, that will look different slightly at some schools based on their specific programming. For example, some of our dual language schools, there's some additional consideration to ensure we maintain the integrity of their program. There are also some self-contained special education classrooms.
Well, Mr. Chancellor, let's just drill down on specifics. I mean, how's that going to be equitable between Minor Elementary and Maury Elementary, just a few blocks away from each other, but have significant difference in their at-risk student population and the students who could benefit from this? If they're each going to have an 11-seat classroom, how's that equitable?
It's equitable in that we are prioritizing the same groups of students across all schools to ensure.
Why not have a school-centered model where some schools have greater need than other schools?
I'm not sure I'm tracking with your question, but I do want to be clear though that you mentioned that in-person learning classrooms will be taught by people that are not certified teachers. In-person learning classrooms will be taught by certified teachers. And
I said the CARES classrooms.
For our CARES classrooms, there will be training for all staff that are transitioned to our student care classroom before those individuals start work. It's also important.
Yeah, we heard in the previous hearing, we'll have 3 days of training on that.
Yeah, and it's also important.
I'm going to try to move to more questions because since we're only going to get one round.
The expectation is that the teacher is still also engaged with those students virtually.
Yeah, I hear you on that. So we're not going to be providing testing at the school, correct?
We will be providing testing for symptomatic students or staff members.
Okay, and then you said if someone exhibits a symptom, when they come in, they're going to get use one of the rapid tests.
Yes, we have the ability to provide rapid tests for symptomatic students or staff.
All right, what's the false positive rate on the test you're using?
I don't have that information. We can follow up with you on the actual test that will be used. Again, that's been vetted by DC Health and is provided to us by DC Health.
All right, most of the rapid tests have about a 30% error rate. So I think it'd be important to know what the rate is going to be in terms of that. In terms of our nurses, I heard you talk about having nurses assigned to every school. Is a nurse going to be in every school?
There will be a health professional in every school all throughout the day of operations. And
that's going to, and when you're saying the tiers between a nurse tech, a nurse, and others, there will be a health professional full-time in every school.
That is correct. There would be a health professional in every school that is operating in-person services during operations.
Okay. What's going to happen for the person who shows symptomatic and comes in? Are they expected to quarantine on site in the school building while they're awaiting the results?
Yes, there will be an isolation space within every school where we will isolate symptomatic students or staff members.
All right. And if they take the rapid test and the rapid test comes back negative, do they go back in the classroom?
If the individual is symptomatic and the rapid test comes back negative, yes, they would report back to the classroom. Again,
we got a high error rate on the rapid tests. If they're symptomatic, we're going to put them back in the classroom.
Yeah, so the individuals, are you talking about that day or are you talking about in general?
Well, the way you laid it out is that if I show up to school, someone's going to take my temperature. That's a good step. If I report I'm symptomatic, you're moving me into isolation. I'm now taking a rapid test. If my rapid test comes back negative, am I headed back into the classroom now?
No, so if for a student that has say for example, I'm gonna make sure I follow your line of questioning. If you're ill, you're in an isolated space and you take a rapid test, we will still reach out to the parent or guardian and ask that the parent and guardian come pick that student up to take that student home.
So even if I test negative, I'm being sent home for the day, or I'm being asked to go home for the day?
You will be asked to go home for today. However, a student that has a negative test can return back to school. Of course, we would ask the family to continue to monitor that child's symptoms or conditions.
I mean, I think when we've got a rapid test that has a pretty high error rate, and if they test negative, even if they're symptomatic, but we're letting them go back into the classroom, that feels like that's dangerous. Do you feel that this plan?
So I want to be clear, the student
would put any community spread at risk?
So to be clear, the student would not go back into the classroom that day. However, we would ask the family to pick that child up and ask the family to continue to monitor the student's symptoms.
But are they being asked to do it, or they're being told to do it?
They will be asked to do that. If the family or guardian cannot do that, the student will remain in the isolation room for the remainder of the day.
All right, my time's up, so I'll yield here. I'll follow up with a letter with a lot of extra questions because I don't know if my confidence was increased here. All right, thank you, Mr. Chancellor.
Thank you, Councilmember Allen. We'll now turn to Councilmember Nadeau. Good afternoon.
Thank you, Chairman. Chancellor, just to pick up on some of the testing questions. So why aren't we doing, let me just put it this way. So up to 45% of cases never develop symptoms, but can be contagious. So why aren't we doing regular testing of asymptomatic children and teachers and staff?
Regular testing of asymptomatic individuals has not been proven to be superior to our other mitigating strategies. What has been proven that mask wearing, our social distancing standards, cohorting students, all the other protocols for health and safety that Dcps has layered on and will implement have been proven to be superior in mitigating the transmission of COVID-19, which is the reason why we are electing to utilize those strategies over a randomized required testing procedure. The CDC has also been really clear that requiring students to test for entry in school or requiring students to test on a regular basis has not been proven to be effective, and there are concerns around equity and access and testing.
Interesting. Thank you for that. I appreciate it. Could you say more about the concerns about equity and access to testing? I mean, if we're providing the testing, presumably it would be available.
For example, the concern is that if a family is going to get regular testing, there could be transportation barriers, or there could be other barriers that would prevent all families having the same access to testing.
I see. So in those scenarios, the testing isn't provided at the school.
That is correct.
Speaking of transportation issues, how do we think differently about the challenges of a school system that is based on choice, where students are moving across the city to get to school, maybe taking public transit, which is different than most other school districts where children are simply staying within their neighborhoods? How are we correcting for that in terms of spread?
Yes, we continue to consider the health and safety of our students that rely on public transit or on the transportation.
how are we considering the impact of that? And how many students will have different instructors because of this plan?
So we did consider in this process the challenge of having a transition, and we wanted to mitigate transition. However, we believe the benefit of fulfilling our mission to respond to needs of families that we know are having challenges with in-person learning was worthy of these efforts. And so as a result, we are, again, modeling our structures at schools to minimize those transitions. And we're providing professional development for teachers to ensure that there is dedicated time for fostering relationships among students with their peers and students and staff when there are transitions. And we don't know actually the scope of those transitions as we are making offers to families at this time for our in-person learning classroom. So if a student chooses the in-person learning classroom, is a chance that they'll have the same teacher that they have now, because our in-person learning classrooms will be taught by the same teachers at that grade level at that school. If a student has a teacher and that teacher is going to in-person learning, they may have to choose a different teacher or have a different teacher at that grade level at that school if that particular family prefers to have virtual instruction, and that is the preferred model for that family.
But it doesn't, families aren't really going to get to choose, right? I mean, not everybody's going to be offered a seat. So if their teacher goes to the classroom, it's not like they're choosing virtual learning if they don't have a seat in the classroom.
So if they don't have a seat in an in-person learning classroom, they can choose, if they offered a seat, they can choose to take an in-person learning seat. If they offer a student care seat, they can choose to take that seat. However, if they choose to maintain virtual learning and learning at home, they will be assigned to a teacher at their school at their grade level.
So I'm wrapping because my time is up, but there's 7,000 students who will be offered seats for in-person learning, but that's going to ultimately disrupt 40,000 students who will remain virtual. And so that's the issue that parents are really grappling with right now, is their child may have just bonded with their teacher, and now they're going to have to change. And I don't know how to rectify that with this plan. It's really stressing out the teachers. I'm sure you'll have a chance to talk to more about that to other members. I see Councilmember Grasso is wrapping me up. Thank you.
It's important to know if you're virtual.
Chancellor, I'm sorry, you're going to have to incorporate the answer into one of the other rounds.
I will do so.
Time is up. Thank you very much. We're going to go now to Councilmember Pinto from Ward 2. Councilmember Pinto, 10 minutes.
Thank you, Chairman Grasso. And thank you very much, Chancellor Farabee. So picking up on your comments around increasing access to rapid testing and how that would present an equity and access concern, I can see that argument if we were mandating that every student go to a different site to get tested. But why not provide rapid testing for every student and teacher who wants it on the location of each school?
Yeah, we, again, as mentioned earlier, don't believe that there is significant evidence. We haven't seen any strong evidence that suggests that testing asymptomatic students or staff on a regular basis is a superior mitigating strategy compared to what we know are strong strategies that are included in our plan, which include mask wearing, social distancing, cohorting students, ensuring that there's minimal transitions throughout the day, and many of the other strategies that we incorporated, and including our Hvac enhancements. And so that is the reason why we believe that the strategies that we have are the most appropriate for reopening our schools.
Okay, and I heard your points earlier about that you don't think it's the best mitigating strategy, but are there any other hurdles in place that would prohibit you from going down this route, given the comfort level it would provide the students and families and teachers, particularly given that we know many folks are asymptomatic and still may be carrying the disease?
Yeah, I think the challenges would just be the operations of how students would be tested, when they would be tested, when staff would be tested, when that would take place, how that would impact operations.
Okay, so it's not a cost barrier.
There's no cost barrier. The city has the capacity to do testing. There are limited supply of rapid tests. So we would, that would obviously be a consideration. But in terms of the traditional COVID test, the city has, a sufficient supply. Again, it's important to know if a family chooses to do that and a family prefers to be tested, we welcome that. If families across the city can choose to be tested at any of our sites, and we again have set aside prioritize time for our staff members.
Right. Okay. So I think one of the main reasons that we're here, of course, is to get more clarity on term 2 to ensure that all of our school communities feel safe and confident in these plans to reopen. And I want to discuss with you the dismissal of School Without Walls and School Without Walls Francis Stevens, Principal Richard Trogish. The lack of transparency surrounding the dismissal of Principal Trogish has made this goal of comfort in the reopening much more difficult. And I'm very concerned that DCPS employees across the city may now be fearful to speak up about their concerns for school safety for fear of retribution. And frankly, I have already heard from teachers and DCPS staff with those concerns. DCPS owes it to all of our teachers, staff, and administrators to provide more transparency around the dismissal so that trust can be built between DCPS and the broader community. And so can you speak, Chancellor, if you've received the letter that a number of us wrote to you asking for more answers, and if you're able to provide some clarity around what the enrollment anomaly was, what the process for the investigation was, if this is a common practice that has happened among other principals, and give us some more clarity there.
Yeah, so we provided to the council and to the public the information that we can share at this time, and that the departure of Principal Trogish is not related to health and safety or health and safety advocacy. In fact, I wanted to ensure that that was very clear to our principals, and thereafter this concern was raised, shared with all of our principals, that we welcome their advocacy as relates to the reopening of their buildings and health and safety protocols, which is one of the reasons why we wanted to ensure that principals are part of the walkthroughs and the readiness checklist, along with other building representatives, to ensure that individuals that are actually in that building have the ability to ensure that all of our health and safety checklist items have been fulfilled and our schools are ready and prepared for opening.
Okay, but given the timeline of the concerns raised about the health and safety standards of his school and then his dismissal, even if there's a complete other justified reason for his firing, the timeline is concerning to other teachers and principals who may want to speak up about the health and safety standards for their schools. And so that is one of the primary reasons that we know it is so important to share more information with the public.
Yeah, we've encouraged our principals to continue to be advocates for their school communities around reopening. And as I mentioned earlier, we want them to be a part of the reopening process and ensuring that all of our items on the checklist are complete. We believe so importantly that in-person learning is critical, which is why we've done the work that we've done to date to ensure that our schools are ready and prepared to provide this experience. It's something that we don't take lightly. It's a mission that we're determined to fulfill. We're going to do that in partnership with our principals. And we want them at the table as we complete our walkthroughs and complete our readiness checklists.
Okay, so do you have the data around which HVAC systems have not yet been updated and what we're doing to remedy this?
Yeah, so Patrick Davis, our Chief of Operations, is currently monitoring in partnership with Department of General Services the implementation of our HVAC work. So I'll have him speak to where we are, but it's also important to note that we are providing in each classroom a medical grade mobile HVAC unit that allows for maximum filtration for our schools, and allows coverage of approximately 1,000 square feet of healthy ventilation and filtration for a classroom. And on average, a classroom is about 700-800 square feet. We also have Mr. Setti, who is with the association that I referenced earlier that is supporting schools nationally as it relates to standards for ventilation and filtration for schools. So I'll stop there and give a moment to Chief Davis, who can speak a little bit more where we are in implementation.
Is Chief Davis on? I don't see him popping up here, so let's make sure he moves on pretty quickly. This is her time.
While Chief Davis is getting set up, I can go to another question. We can circle back to him if he comes on, which is that term 3 is going to increase the number of elementary school students in in-person classes, I imagine. And so what consideration has been given to using non-school building spaces? Are there any updates on accessibility for outdoor spaces or partnerships with museums or private buildings that I've asked about in previous hearings?
Yeah, so DCPS has encouraged schools to maximize outdoor space. Obviously, that looks different for each school because their footprint is different and their ability to utilize their space is different based on their community and surroundings. This is also a part of our student support center model, which is currently being implemented at select schools, and we've encouraged schools to utilize outdoor space as well. We're currently not considering utilizing other spaces outside of DC government, given that we have less controls around their health and safety protocols, and we want to ensure that we are inviting students back to spaces where we have full authority and control over the conditions in the facility. I believe Chief Davis is on now. He can speak to where we are in the process on our HVAC work.
Yeah, sorry, it took a minute to load in. Yeah, as the Chancellor mentioned, I think it's important to know that all of our schools are receiving an HVAC enhancement. It's going to look a little bit differently depending on what the systems are at the school. So I can share that every school has had their initial field visit done by the contractor. And as Chancellor mentioned, we've got a professional engineer doing the site-specific planning. So that'll vary depending on the systems at the school. So for a school that does not have a centralized HVAC system, they will all receive portable, true HEPA filters in every single learning space, plus many additional units to support, main office and all the other nurses suite, isolation room. If a school does have a centralized HVAC system with a DOAS, which is a dedicated outdoor air system, modifications will be made to that to increase the amount of fresh air and filtration in there. But as James mentioned, every single classroom across the portfolio will have a portable mobile HEPA filter unit in there, which includes a UVC light kit.
Okay. Thank you very much, Chief Davis, and I'll follow up with additional questions around those standards. I know I'm out of time, Chairman Grasso, so want to thank you all and reiterate my request that we have more information shared with the public around the dismissal of Principal Trogish and reconsideration for rapid testing at all of our schools.
Chief Davis, if you can just stay on, I mean, you can turn off your video and stuff, but stick around in case there's further questions in this regard. Councilmember Che.
Thank you very much, Mr. Chairman, and welcome, Chancellor. Some of my questions have already been answered, but I do have others or follow-ups. First of all, there's been a reference to a whole variety of things, readiness checklists and protocols and this and that and the other thing. I have been asking on a regular basis to get copies of all of these documents. I'm not sure that I've gotten them, whether it be, for the programmatic stuff or the building stuff or whatever. I would like, first of all, a list of all of these things that you keep referring to, please. And then I would like to have a copy of them. Can that be done?
Yes, we're happy to provide you with a copy of our checklist. We're happy to provide you with all of the materials related to our health and safety protocols. And then we'll also provide you with a memo on the HVAC enhancements.
Okay, that would be great. And each time I've asked for this, I get that same very positive reply, but then I actually don't get the information. So What I'd really like is a list of all of the things that you have, reduced to writing. And then as you get it to me, I will check it off and make sure I have it. One of the reasons why I want those things, as you might imagine, everybody knows we're all on the same page with this, that the students and the staff, they have to be safe, but they have to feel safe, including the parents. They have to feel safe. So more information, more assessment about what's being done, and checklists that they can look at would add to the confidence. In the vacuum of information, anxiety and concern blossoms. So it's really, really important that this be made available to all of us and to the public. And in addition,
can I respond to that quickly? So,
yes.
you mentioned concerns. Just please keep in mind, one of the reasons why you may have had some challenges with collecting those documents or receiving is that they have been evolving as we've received feedback from our labor partners and our parents. So we wanted to finalize the checklist for school readiness to be reflective of those ongoing discussions.
Okay, but since I've been asking about this for some while, you could have put a stamp on it, draft, perhaps subject to change or something like that, so that we could have them. And then, in fact, that would be better because then we could see what was added or what was changed or what have you. So I don't want to wait until, what's the date that there's going to be this opening?
So our school readiness walkthroughs, tours will begin next
No,
week.
just the date. What's the date?
The date,
Kids are going to be back in school.
November 9th.
November 9th. Okay. I don't want to wait till November 8th to get all this stuff. And then you bring up something which I'm very interested in, which are the tours. You may or may not know this, but I do readiness tours at all of my Ward 3 schools before school starts. I look at everything. I go with the principal and others and, representatives of the community, et cetera. And we make a list and we check it twice and be a pest till things are done. This year I did it virtually because of the circumstances. But I want to do it again. And I've asked to be part of these tours. But aside from my visuals, I need to have these materials so that I can ask about things. It's not perfectly obvious to me what I need to see or inquire about. So I have to have that ahead of time, and I have to set that up. The schedule has to be arranged so that I can go to these schools. So I really need that information, and I need to be part of those tours. Plus, despite the fact that you may be able to get some community representatives in on these tours as well, I've been thinking what an idea it might be, if you're willing to have your principals do this. How about having the principal or somebody, so that the principal's not burdened with the assignment, go through with a video camera on these tours and put those up online, because then everybody in effect can be on those tours. Can we do something like that?
Yeah, so I believe I mentioned that earlier, is that one, council members will be invited, those interested, to participate in our school readiness walkthroughs. Those will begin next week on Thursday. We are encouraging principals. We're currently working with principals on a way in which we could have some type of virtual walkthrough that could be potentially reflected for families to see some of the work that's being done in their buildings. I know that we've already had that done at one of our elementary schools, and it was received well. The principal there, Principal Gorman, did a walkthrough at C.W. Harris, and we were able to show some of the work there. So that is something that we continue to explore we'll explore with our principals.
Okay, and beyond continue to explore, I wish you would simply commit to do that for every school that's going to be opened, and make it available to all the parents so that they can be in effect on these tours as well. I don't think it should be explored. I think it should be done. And so from you can say, you should do this, which is what I think you should do. So will you be willing to do that?
I can't make that commitment today because we want to ensure that we have each school equipped the appropriate technology, and we are able to fulfill that need at every school.
Really, you can't get a camera in somebody's hands to walk around as we're on the tour? Really? You can't do that. That's
I'm not saying we can't do that. I'm saying that we're not going to make that commitment today.
well, you should make the commitment today and you should do that, but okay. The other thing I wanted to follow up on is something that Councilmember Pinto was pursuing, and that is the continuity of instruction with known teachers who have already established a relationship with their students. And before I get to the bigger question, there's a subset of that that has been brought to my attention by parents in schools round by me. And that is, you're bringing in, and they'll be trained in some fashion or other, personnel for these CARES classrooms. And that's all very well. But the parents have said to me, why would you not use the after-school program teachers who have a relationship with many of these students already? Why have a whole different set of people? Why not use these folks that have established these connections? It seems to make a lot of sense to me. Was that considered?
So we have explored partnerships with after-school care providers and other partners that work in our school as an option to be partners in education for us for our care classroom. And we're currently working now to hire individuals or partner with organizations to fill the positions for our care classrooms.
So for example, at Janney Elementary, they have these after school programs. Can I tell them that the teachers or however they're labeled, that those folks should be in touch with you because you're going to consider them for these CARES classrooms?
Could you tell who at Janney Elementary?
They have after school programs. I'm just taking them as an example. They have after school programs. Can I tell them, those who are the instructors or however we label them in those programs, that they should be in touch with you because right now you're considering whether to hire them for these CARES classrooms?
Absolutely. You should definitely tell them that. And any other partners that support our schools, we welcome their service as a part of our care classrooms, as long as they meet our criteria and in terms of work status and ability to work, we're happy to partner with them.
Okay, but you have not, from your perspective, reached out to this whole cohort of instructors or teachers or after school personnel to invite them in. They have to affirmatively contact you. You haven't done that, right?
Yes, we have. When we started our student support centers, which are currently in operations, we reached out to our partner organizations as well. So we have considered our partners all throughout this process for in-person experiences.
Including all these aftercare folks.
Including all of our aftercare providers.
Okay, I'm out of time, but I'm just going to remind you, you're going to give me a list of all of the, checklists and protocols, all that. You're going to give me a list. If it's not final, you're going to put draft.
We've got all this, Councilmember Chang.
Okay.
Thank you. We got it. So we have it on the record. It's recorded. We're going to move on, but thank you.
But I wanted a yes.
Yeah, well.
Councilmember Grasso, I just wanted a yes. Okay,
Yes,
thank you. Thank you very much.
yes.
Thanks.
Councilmember Silverman.
Thank you very much, Mr. Grasso, and good afternoon, Chancellor Farabee. So there are two basic needs here. I think for almost all of our students, in-person learning is preferable to distance learning. And certainly the literacy scores released by the mayor yesterday indicate our students are in an extended summer slide. And the clear message that I think was sent yesterday was that we need to get our students back to the classroom. But then we also need our schools to be safe for teachers, administrators, students, and their families. And this has been reiterated by my colleagues, but all these groups need to be both comfortable and confident in their safety. And I just say this, Chancellor, because I am concerned that where we are with term 2 right now, these two basic necessities, optimal learning environments and health and safety, are being presented somewhat as an either or proposition when it needs to be both. You know, our staff and students and parents need health and safety protocols and protections they can understand and trust. And I just don't think that is true. I do want to go back to the PERB ruling though. My understanding of the PERB ruling is that DCPS avoided bargaining on key issues about reopening, especially when it comes to health and safety. And the message I'm getting, and I think all of my colleagues are getting from teachers, is clear. They do not trust DCPS and don't believe that DCPS cares about their health and safety. And I'm concerned, Mr. Chancellor, that we are at risk of losing some of our most dedicated and talented educators if they see no other way to be safe than to resign or retire. So with the PERB ruling, it clearly said that DCPS violated DC law in issuing 3 things: the June 30th guidelines and intent form, the September 29th health and safety protocol survey, and the September 29th teacher survey. My understanding is PERB ordered you to rescind all 3 of these. Has DCPS rescinded all 3 of them?
So we again are very much so committed to ensuring that we're as transparent as possible around our health and safety protocols. And in fact, many of our health and safety protocols extend beyond what is happening nationally for schools that are operating in-person learning. And there are many school districts across the nation that are operating in-person learning. And I think you cannot find many where you can point to, for example, who've done the HVAC enhancements that DCPS has. As relates to the PERB ruling, DCPS have, as you mentioned, received the notice and are responding accordingly. And we have until Tuesday to comply, and we will do so. But we believe the most important thing that we can do right now is to continue in our bargaining conversation with the Washington Teacher Union. And that is to reach an agreement around our health and safety protocols. And I'm pleased, I have indication I will go back to our bargaining team once we've concluded today, but I have indication that we have agreed to our health and safety checklist, and there's only a few matters.
I do not mean to interrupt you, Mr. Chancellor, but I think I only have 6 minutes left now. We are under a 2-week deadline, basically, to get to this term 2 reopening. Why are you confident that on these key issues of health and safety that you can reach agreement by Tuesday?
So
and what happens if you don't reach agreement?
Well, we will continue, the expectation will continue to go forward because the 2 remaining outstanding issues are not health and safety related.
What are the 2 outstanding issues?
One issue is that we have been requested to delegate authority to individuals outside of DC government to determine if the school should open and operate. We're not going to delegate that authority to individuals that are not in DC government.
So this is what the WTU is asking for, Mr. Chancellor?
That is correct. They're asking that individuals of the community decide when and how schools should reopen. And we're not going to agree to that.
Okay. And then what is the other outstanding issue?
And again, these conversations are fluid, so I don't know where they are now. They could be resolved now. Okay. The other issue is that teachers should determine whether they come to work in person or not. And we're not going to agree to that. This is not going to be
help me understand that. So that seems like a critical issue here, which is and it gets to the rescinding of the teacher survey. So how are you going to determine who is going to come back to the classroom if you've had to rescind the teacher survey?
DCPS has the management right to make assignments. Our hope is that we can utilize information that we've collected because it allows us to rely on information that supports the accommodations that are very generous. Our accommodations have gone beyond the federal and local standards, and we want to provide those accommodations to staff. But if we're not able to provide those accommodations based on the data that we've collected, then we'll make assignments in other ways.
So this gets back to my concern, Mr. Chancellor, is that my understanding of your answer is that you have the right to just make assignments, whether or not the teachers indicate that they want to come back or have health and safety issues that are the reasons why they don't want to come back. And I am very fearful that if you take that action, that is really going to break the trust of our teachers and could be irreparable damage here to our reopening in term 2, term 3, and in the future.
So I want to be clear, what I stated is that teachers want the option. If there are pre-existing health conditions, if there are circumstances that are in line with the CARES Leave Act or other leave provisions, we will definitely honor that. And what we've extended to teachers goes beyond that. Okay. However, if you do not qualify for any of those provisions, we cannot simply say to you, you come to work if you want to or not. We just can't create a structure that working in person is completely optional regardless of your situation.
Okay, I'd like to pursue more, but I want to switch to the issue around equity. I think Councilmember Allen had asked about this before, and I want to continue because my understanding from you from our prior hearing is that there were certain categories of students who were prioritized, and homeless and at-risk students were one of the groups. But I am confused here how we reach equity with this plan, because if there's one school that has 100 at-risk kids, and let's say 10 slots, and then another school has very few at-risk kids, but still 10 slots, then how does that achieve equity?
So we wanted to ensure that there was minimal disruption as possible for all students. And so having additional in-person learning beyond the one class per grade level every school would create more transitions. And so that's one of the reasons why we established the student care classrooms. The student care classrooms also considers the prioritized groups that we reference, but it gives us the ability to provide additional capacity for in-person experiences. However, teachers will be with their students virtually, but it does give students the benefit of some of the social emotional development that can be provided in person that cannot take place with remote learning.
Let me follow up on the CARES classrooms, and I think this is maybe a follow-up from Councilmember Che. Is there research or education literature that these CARES classrooms will lead to better learning? What is our evidence that this model works?
Well, there's clear evidence, and this has been noted by many pediatricians who raise concern about students not being in schools. It's important to know our students haven't been in school since March, and there are significant risks for students not having in-person engagement with their peers and their teachers. There's also a body of evidence around literacy instruction and the challenges of early literacy instruction that is not done in person.
Even if these are not literacy trained teachers?
So the student will have the ability to be with a teacher providing that instruction virtually, but they will receive all of the other supports and benefits of in-person via the care classroom model.
On that note, Chancellor, Councilmember Silverman, your time is up. Thank you for your questions. I'm going to turn now to Councilmember Robert White.
Thank you very much. I want to start by expressing my disappointment and significant frustration. Chancellor, you should have worked with parents and teachers on this. To work on this completely behind closed doors, throw something at folks that's still evolving and expect that we're just going to digest it and move forward, and it's not going to have significant impact on trust, on confidence, and frankly, whether or not we will go back into these schools was unrealistic and unfair. It was unfair to parents. It was unfair to teachers. I can tell you as a parent, I have a 19-month-old and a 4-year-old. Every day starts at 5 a.m. It ends late at night. My wife works from home. This is exhausting. It is stressful. It is unsustainable. And we recognize that there's learning loss when our kids are not in the classroom. But it is not just as simple as saying, okay, well, there are slots for in-person learning, whether it's a CARES classroom or in-person instruction, come on in. This is a reality where COVID-19 has taken the lives of over 200,000 people from every single age group. So every teacher, every parent is making a heart-wrenching decision, balancing the desire to be back in person in school on one hand versus the real risk that it presents to people's health, safety, and their lives on the other hand, because it is not a question of if there will be COVID contraction in schools. The only question is how much and how it will impact these students, these teachers, these families. And that is something that we have to take seriously. So this autocratic approach that Dcps has taken is, in my opinion, completely unacceptable and has really threatened the stability of our schools. Because as a parent, I know I'm supposed to get a call, today? And going to have 48 hours to determine if my daughter's going to accept a slot to go back into school. I can't make that decision. I don't even have enough information. And I'm a council member, for God's sake. So how are parents, how are teachers supposed to make this determination? We just don't have what we need. And because this process has not been transparent, we can't just say, well, we trust what DCPS has done, or we agree with the compromises because we have been left out of this process. But let's move into some questions. So using staff from secondary and high school classrooms or administration for the lower grade in-person learning, how is this going to impact returning to in-person learning for secondary schools?
Yeah, we have had recent conversations with our high school principals around their operations and additional considerations as relates to staff assignments. We will continue to collaborate with them on the best way possible to maximize staff for CARE classrooms, but also to consider the supports needed for success for our secondary students.
How many secondary schools are going to have staff reassigned?
I'll go back to, because I think you make a good point I want to respond to about the challenges that you've experienced with learning at home, and considering the resources that you have. The reality is that not all of our families have the resources that you and I are fortunate to have, and there's a need for us to be responsive to those needs to those families that don't have.
There's no question about that. And I was going to go into a diatribe about how insisting that preventing learning loss does not compete with the need to be transparent and engaging. But I think Councilmember Silverman handled that well. So I skipped that part. I agree with you. There is a need to return to in-person learning. But the way that we have done this was not necessary, was not transparent, it was not collaborative. And I just don't think that there's any way around that fact. But how many secondary schools, Chancellor, are going to have reassigned administrators and staff?
So we've considered every secondary school in terms of their staffing plans and how we could utilize staff from our secondary schools to support in-person learning experiences of our CARE classroom. But we have simply had a lot of engagement since this summer with families, surveying them, asking them the questions. I've had lots of meetings with families. My parent advisory board has been very engaged with providing feedback on where we are. And we spent over 100 hours in conversations since this summer with the Washington Teacher Union Plus and understanding what their concerns are and how we can respond. So this notion that we haven't been collaborative we haven't been talking to people just isn't accurate.
Well, I've sent a letter with other council members that has been ignored. Parents reach out to me every single day, and my wife is engaged in one of those conversations. So I know what the substance has been and has not been, and we have not been given anything that we can give feedback on. So it just the engagement that you're describing is not engagement. It's talking to people and giving some people the ideas that you're working from to solicit feedback, informed feedback are different things. But if we cannot reopen lower grade schools without pulling staff from the higher grade schools, then how are we going to, with reduced staff in these secondary schools, how are we going to reopen those for in-person learning?
So in-person learning classrooms will be staffed by elementary teachers at their school.
But the secondary schools at some point will have to reopen for in-person learning, but some of their staff is already going to be pulled into elementary schools.
Yeah, in-person learning classrooms will be taught by teachers at their school, whether it be elementary or secondary.
But they are losing staff, correct, the secondary schools?
Teachers are not being asked to support student care classrooms at our elementary schools.
So what type of staff are being pulled from secondary schools?
Support staff. So
the assistant principals?
Assistant principals.
Librarians?
I'm not sure about librarians.
Can you tell me specifically what type of staff are going to be pulled from secondary schools?
Behavior techs, office support staff, individuals that are not currently engaged with direct instruction.
All right, so those folks are not necessary when in the secondary schools when they reopen to in-person learning?
I don't know that we would say not necessary. I think we are currently working with our secondary principals to determine how it would impact their schools currently and how it would impact their schools as we track towards term 3. And we will follow up with them with any adjustments that will need to be made to ensure that we're able to successfully operate now and as we enter in term 3.
What criteria is DCPS going to use to determine if schools will need to close as a result of increased COVID cases? So I heard you mention earlier case by case basis, but what data are you using?
So for all of our schools as a whole, we will continue to monitor any positive case within their building and the scope of any positive cases in their building. Across the board, DC Health will continue to guide and advise operations for all of our schools using the same indicators that are associated with the monitoring of our health conditions during this global pandemic, which includes the positivity rate, which includes the number of cases and our ability to respond to.
Wait, so it's going to be school-specific data, not citywide data?
It definitely be citywide data will be considered.
Oh, okay. With respect, this conversation came up a few times, but I want to clarify with the in-person testing. So your answer to, I think, council members Nadeau and Pinto was that you're using other strategies that disregard the necessity for testing, but one does not preclude the other. So for instance, small kids are not going to social distance. It doesn't matter what you tell them. They're not going to keep their masks on flawlessly. So, you can implement all the other protocol that we all understand the science says are necessary, are more helpful than testing, but one doesn't preclude the other. So there's still not a reason that I can understand why we won't do on-site testing. Kids are going to be riding the metro every day. Significant percentage of people are asymptomatic, but they can still spread it. And young kids just will not follow all these protocols. So can we get a commitment to do in-person testing at the schools for all teachers and students?
We will provide in the building testing at all of our schools for symptomatic students or staff member. As I mentioned earlier, there's very limited science on requiring regular testing on asymptomatic individuals and the ability to mitigate the transmission of COVID-19.
If a student, this will probably be my last question. If a student has a fever.
What we do know is that our mitigating strategies are research proven. And we do know that we have had daycare facilities, facilities serving young children. We've had
All right, Chase, I do have to reclaim my time because I did hear you earlier, and I wanted to clarify. If a student has a fever, so they've not tested positive, if a student goes home because they have a fever, what is the process for them getting back into school? And how do you know, how does the school know if they ever even tested for COVID?
And so we would ask the family to continue to monitor those conditions. If the family indicates that the student doesn't have any of those symptoms, we would ask the family to return that child to school. If they continue to maintain those symptoms, for example, if they have a fever and they continue to have a fever and the fever doesn't break, we'd ask the family to continue to keep that child at home.
Thank you, Chancellor. Thank you, Councilmember White. Councilmember Bonds.
Yes, thank you very much. And thank you, Chancellor, for talking with us about this very important subject matter. I've been listening, and I must say, to some degree with awe, really and truly, because when I want to know, when we talk about the school system and our charter schools, enforcing the compliance, if teachers and students refuse to, as my colleague said, wear masks, because we know young students do not do as we ask them to do. They will not keep social distance, or a report of illness the day prior to entering the building. What do we do about that? What is our responsibility as the school systems?
Yeah, so we will ensure that there's appropriate training for our staff and our educators for in-person experiences, and then that they are equipped to appropriately train students as well on our health and safety protocol. We know that
and I don't mean to cut you off, sir, but you say we will make sure. We're talking a few days before we open these classrooms or these buildings and classrooms. So you're saying that the training has not yet occurred, but it will occur. Is that correct?
Correct. Training will occur before staff members go into in-person experiences, and they will train all of our students on our safety systems to ensure that students understand what's expected of them.
Okay, so then I have to ask, what is the methodology that you will use for screening everyone that enters the school building?
So first, that screening process takes place at home. And we are providing a list of COVID-19 symptoms that we expect students and staff to screen themselves for, and also screen themselves for any potential exposure. And then when they get to the building, there'll be another check of those symptoms and exposure, and there'll also be a temperature check from a staff member or a medical health professional before they enter the building.
All right, so my student wants to go to school, and I have the checklist. Is there a place for me to sign, to leave my signature saying I attest that Johnny has all of these conditions are positive and can enter the school? Is that something I hand in, or he hands in as he walks in for his second grade class?
The expectation is that that's completed before a child comes to school. And so we're not asking families to bring that form in each day. However, there's a written form that is utilized at the school when the school completes the second screening before the student enters the building.
Okay, so the first entrance to the building, it's just, you can ask Johnny if he's okay, and he'll say, yep, I'm fine. And he goes into the class with everyone else, right? Is that what I'm hearing?
Could you repeat that question?
What I'm suggesting is that the student will be able to enter the building without any questions primarily, other than, are you okay? Is everything fine? Did you meet the requirements on the checklist? Is that correct?
So,
in other words, word of mouth, because you're not going to have anything in writing from the parent that says, I certify that that this was the condition this morning or last evening.
So there will be a screening at the school that is a written checklist that will be done before students enter the building.
Okay, that's what I'm trying to, that's where I'm trying to move to there. Okay, I just had a quick question about your definition of at risk in this prioritized group of students. What is at risk? Is it just our homeless students, or is it some other students that we're including?
That is a designation that has a definition that we can provide to you is based on a family situation. A major consideration is the socioeconomic status of the family,
Okay.
academic performance of the student.
All right, so it's the usual at-risk category. I've heard it mentioned by you a couple of times and my colleagues, and I just wanted to make sure that I understand that whatever is at risk in the definition remains the same, and we're not, moving other students into at risk or moving them out. Am I correct?
Say that again. Do we move
Okay.
out of that designation?
Yeah, I'm just trying to make sure that whatever students that were categorized as at risk, that they're still considered at risk. I heard you say something about at risk and the homeless, and so I wondered if there was some other students that would be included in it that we were not aware of. And this leads to your, where you indicate your inclusion model protocol, your CARES classrooms. I'm trying to understand these terminologies and how the students are actually going to be treated and the expectation in these classrooms. And I know it's getting a little away from what we all are most concerned with, and that's the safety of our students and our teachers and other school personnel. But I'm trying to understand what we're doing here, because I must tell you, it sounds a little confusing. And, I'm a big fan of yours. I believe that you care. And that's a big part of the deal to be chancellor of our DC schools. But I'm really very concerned, sir.
Thank you for your concerns and the affirmation. So I want to go back to your original question. I think I understand it now. The definition for the at-risk designation is the same one that is defined in DC code that is used for our funding model. And so each school receives an additional weight for funding based on the number of at-risk students in their building.
All right.
We also prioritize other groups of students, including students that are experiencing homelessness, students that are language learners, and students receiving special education services. You could go across those groups. So you could be at risk, and you could be a language learner, and you could be receiving special education services.
So did I hear you indicate that those students you just described will be in a separate environment from the other students?
No, so they'll all be in the same environment unless a student is assigned to a self-contained special education service based on the intensity of their services and the uniqueness of their services. All right.
I really wanted to make sure that we, at least for me, that was clarified. Thank you very much. I really want to talk a little bit real quick about during the previous performance oversight hearings a few months ago, there were a great deal of discussion about the condition of the school bathrooms, the lack of running water, soap, toilet paper, even doors missing from stalls. And I wondered if, how is that being addressed? Do you actually have a checklist that says for each of the school buildings we're opening that all of this is in place and ready to go? And if so, could we see that? Because we know that some of these issues are rampant throughout the system.
Yes, there will be, as a part of our readiness checklist, items that we will confirm that are in operations as relates to plumbing, sinks, restrooms in our buildings, and will be one of the items that individuals can observe and review as a part of the tours. And as I mentioned earlier, council members are welcome to be a part of that tour process as well.
All right, thank you. And then finally, what is the main lesson that was learned from the New York City experience that we have to be aware of when we are opening our schools here in DC?
They're very early in their implementation, and so I think it'd be premature at this point to say that we can learn from what implementation looks like. I think the biggest learning is we know that in-person experiences can be provided, it can be done. We have an urban school district that has significant numbers and operations. I also believe it's a confirmation in terms of the groups that they prioritize for in-person learning are the same types of students that we are prioritizing as well.
Okay, thank you. And finally, are we assured that the virtual learning will continue?
Yeah, so any family that prefers virtual learning will have that option for this school year and the foreseeable future.
Thank you. Thank you, Councilmember
Thank
Bob.
you. Thank you, Chairman.
Our last council member for one more round is Councilmember Kenya Mcduffie. Councilmember Mcduffie.
Thank you, Councilman Grosso, and thank you, Chancellor, for your testimony, for being here to answer some questions. No, in March, shortly after the mayor declared her public health emergency, I sent a letter to the mayor and to my colleagues at the council requesting that we make decisions through the lens of racial equity and acknowledging that COVID-19 is really not impacting all of us in the city in the same way. And I think it's without question that the pandemic has disproportionately impacted Black people and Black-owned businesses in the District of Columbia. As you know well, Black people account for 50% of the district's total positive cases and 75% of the total deaths related to COVID-19. And so our school reopening plan really, and my colleagues have been saying this pretty consistently today and throughout, I think, this process, that we have to reflect an equity-based strategy that prioritizes the health and safety of our entire school community. I think that the teachers union has raised some concerns, and I know you all have already gone through that, and so I don't want to rehash it, but they've been very clear in their request for better and more engagement on this subject. I think the decision-making that prioritizes equity really requires transparency and thoughtfulness. And what I've heard from the people who've reached out to me in my office has indicated that DCPS leadership has missed the mark in that matter. And so I think based on the recent decision that we've seen at the PERB, that they would agree, at least in part, with the teachers union. So I think the one thing, Chancellor, that we can all agree on is that our students really do need in-person instruction, and many of them, frankly, would like to return to school to see their friends and be in that classroom setting. And so I want to ask a couple of questions, and I'm going to try not to be redundant and ask things that have already been asked by my colleagues. But on November 9th, when schools open, elementary schools, is every single elementary school in every ward going to reopen then?
Yes, the expectation is that every elementary school across DCPS and every ward will be open for in-person learning and experiences. And there will be a classroom at each grade level. Some schools have more self-contained special education classrooms, so they could have more in-person learning there. But we believe that providing those special education services are critical because many of those services we can't provide in a remote posture.
So you said some schools have more space and will be able to do more in-person learning.
No, some schools have more self-contained special education classrooms.
Okay, got it. Okay, let's talk briefly about ask, look protocol. And just to be clear, for anyone who's listening, maybe started a little late, the DCPS reopen plan does not include testing for all returning staff and students?
So it includes testing for symptomatic students or staff in a building.
So just to be clear, that does not include testing for all returning staff and students?
It includes testing, symptomatic testing for all staff and students.
So is that a yes or a no to my question?
Yes, so I just want to be clear that there's various types of testing. So
so let me stop you for a second because I got 6 minutes left. Is every DCPS faculty, staff member, student, facilities who comes in the building going to be tested? Yes or no?
So testing is not a part of entry. However,
so that's a no. Okay, I got it. That's a no. Whether or not you want to say it, it sounds like that's a no. A lot of what I've read, and you can tell me why this is wrong, but a lot of what I've read about other public school systems that have already reopened is that the ability to test, contact trace, and isolate positive cases is really the only way to reopen schools safely and to keep them safe once open. Tell me why you would disagree with that.
So I agree with you. The ability to test symptomatic individuals in the building is important. And having the ability to isolate those individuals is also important. And the ability to have medical professionals that can—
But here's the thing, realistically, you're gonna let a bunch of people come to the school building, and if you're relying on people exhibiting symptoms, you're gonna miss a whole lot of people, right?
Yeah, but the challenge, Councilmember Mcduffie, is that there's no clear evidence. And I hate to keep repeating this, but there's no clear evidence that testing asymptomatic people on a regular basis is effective in getting the transmission.
But I'm saying you're gonna miss people who are symptomatic, right? I mean, how do you figure you think you're not gonna miss people who are exhibiting symptoms? Like you're gonna capture everybody who might just have a fever, but are not like coughing in a manner that, like,
yes,
how are you gonna capture those folks?
Anyone that exhibits symptoms throughout the day, we have the ability and will test them. And so if you have a fever, we'll test you. If you have any other symptoms, you will be tested as well. We have that capability.
Okay, so you're how do you know if a person has a fever?
So there's a temperature check screening every day before you enter the building.
For every person that enters the building?
For every person that enters the building.
Okay, and so that's every staff, from facilities all the way up to principals and faculty?
That is correct.
Okay, and in terms of the resources that each school has to prepare and to really execute this reopen plan, are they equal, the resources? Everybody have the same thing?
I wouldn't say they're equal. I mean, I think there are resources that will be allocated to schools based on their specific needs. As I mentioned earlier, one of those areas is special education services. Not all schools have the same population and numbers for special education students, and we've adjusted.
But they'll have the same amount of staff doing temperature checks. They'll have the same.
Oh, so will the number of support staff look different? It could be based on the population for that building.
Okay, and in terms of the CARES classes, do all the schools have the same number of CARES classrooms?
No, schools will not have the same number of CARE classrooms. That will be based on the demand and the capacity for those school buildings.
Okay.
And social distancing in our cohorting. And so there are limitations based on the capacity of that particular building.
I know Chairperson Grasso and Chairman Mendelson have done some work in this area about sort of equitable distribution of resources and the ability of some schools to raise funds via PTAs and other manner of fundraising or other contributions. Will that sort of assistance be allowed to be utilized by certain schools that have the ability to do that? Will they be able to augment their support and resources to respond to COVID and to reopen their schools?
Schools receive additional resources based on the student population.
No, I'm talking about the ability to raise money independent of what your budget as a school is.
Do schools have the ability to raise money? Yeah, so PTAs still have the ability to continue to function.
Okay, and then so schools who are able to raise money specifically to reopen and support them with PPE and other things, whatever manner of resources.
So clear, yeah, I'm glad you clarified that question. So schools do not have to purchase PPE. We provide all the PPE. We've already started the distribution process for PPE to schools. So,
but just whatever they might want to use resources for. So if it's not PPE, they can raise money.
They won't have to buy PPE, masks, disinfectant, cleaning supplies, sanitizer. all of that will be provided to schools, and we've already started distribution process.
Okay, and so when you all do perform tests on people who display symptoms, who's going to perform the testing at these schools?
Well, a medical professional will be assigned to do that.
Staff, DC government staff, or contractors?
It could be either or. It could be.
How would that be determined? Do you all have a contract with somebody to administer tests already?
So we have a grant with our current provider for nurses through Children's Health.
And how are you all going to determine where these folks perform tests and which schools they go to?
And we also, there's two sets of medical professionals. There's those that are associated with our grant with Children's Health Hospital, and then
okay. I'm going to cut you off, and I hate to do this. I know you're trying to answer my question, but I got 30 seconds left. In terms of the testing protocols, you probably already mentioned this. I don't know, is it PCR or antigen test or some combination of the two?
Yeah, I don't want to speak to the type of test. We can get you those types of details. That would be best coming from our medical professionals.
Okay, and what about the labs that are going to be utilized to do the results, process results? Have you all determined how that works?
Yeah, so for our public health sites, it'll be the same process that we've been utilizing, but in terms of...
Is it our public lab or some contract lab?
For the public health sites, that process won't change. For our schools, they'll be utilizing the rapid test, and we can provide you more information on the type of rapid test.
Okay, Mr. Chairman, I just wanted to get a sense of who is actually going to be doing the results. Is it going to be at our public lab or some other lab, just to see if it's going to be consistent DCPS wide? Thank you.
I think that's a fair question, Councilmember Mcduffie. I appreciate it. And, we've come to the end of our hearing, but I wanted to take a moment to thank the Chancellor for answering all these questions today, and also reiterate what I said at the beginning. I know that my colleagues have a lot of follow-up questions. I think there's value in us trying to consolidate our questions like we've done in the past to try to not have to replicate and kind of duplicate everything over and over again. And so my office is happy to consolidate along with Chairman Mendelson into one letter, a bunch of questions as follow-up so the Chancellor can answer them and do it publicly as well through the committee. So let me know if you want to do that and just start working with staff and with me if you want to. I also want to note that it appears that in the middle of our hearing, we dropped off of the DC cable TV feed for like 5 minutes, but they got right back on, and also they've recorded the whole thing here, so it will be re-aired, and we can share the full recording for the record, as well as cable TV can re-air it at the right time. So with that, the time is, Mr. Chairman, did you have anything you wanted to close with? Because other than that, I'm ready to close it down.
I don't think so, but I like the suggestion of members submitting questions to your staff, and our two committees are working together to get one letter out to the Chancellor, maybe by, let's shoot for Monday, end of close of business, at least to get the questions from colleagues.
Yep.
So we could get the letter to the Chancellor by Tuesday.
Sounds good. And I'd like, for example, I know one question has been raised a lot is, whether or not we should or shouldn't be doing testing every single day of every single person. And we might want to get a fuller explanation of why that's appropriate or not appropriate. I know Councilmember Pinto raised that and others have too. So let's pull all those together and we'll send it to you as soon as we can. Chancellor Farabee, thank you for your patience and thank you for your answers. The time is now 10 minutes after 5 p.m. It is still the same day that we started, and this roundtable is now adjourned. Thank you all very much.